This is the Tropolitan Above the Fold, where we bring stories from the pages of Troy University's student newspaper to the airwaves of Troy Public Radio. I'm AnnaBrooke Rainey. I'm a senior English major at Troy University. I love to cook, and I'm the writer of this article. Governor Kay Ivey approved the $203,404,327 in funding for Alabama's first year of the Rural Health Transformation Program, or RHTP, after receiving the state's official award number from the Centers for Medicare and Medicaid Services on December 29, 2025. The Alabama Department of Economic and Community Affairs, or ADECA, will be administrating the federal funds for the 5-year program, which seeks to improve the quality and accessibility of rural health care across the state.
Alabama will receive more than $203 million in the first year funding from the Rural Health Transformation Program,
said Governor Ivey in a press release. After President Trump signed the One Big Beautiful Bill Act into law in July, Alabama got to work preparing for this program so we could hit the ground running once our state's new comprehensive rural health strategy was approved. The One Big Beautiful Bill Act slashed nearly $1 billion in Medicaid funds. According to the KFF, a leading U.S. health policy organization, rural Americans are more likely to rely on Medicaid, and rural hospitals, like the 52 across Alabama, often rely on Medicaid reimbursements to stay open. The Rural Health Transformation Program was built into the One Big Beautiful Bill Act to address the effects of the Medicaid cuts. According to PBS, the $50 billion Congress set aside for the Rural Health Transformation Program covers less than a third of the funding rural communities are expected to lose in Medicaid cuts. To take part in the Rural Health Transformation Program and receive a portion of the $50 billion set aside, states had to write their own detailed plans of how they would use the funds within their own programs. Ever since the One Big Beautiful Bill Act was signed, Governor Ivey's administration has been hard at work planning how to best support Alabama's rural residents and health providers through potential funds from RHTP. In December 2025, Governor Ivey signed an executive order establishing an RHTP advisory group to develop policies and advise on implementation as soon as the program was approved. The program also contains 11 initiatives, including but not limited to a Rural Workforce Initiative, Cancer Digital Regionalization Initiative, and Simulation Training Initiative, designed to allocate the given federal funds as effectively as possible across the state. The state has not yet allocated funds to rural hospitals such as the Troy Regional Medical Center, but residents and healthcare professionals are hopeful and looking forward to their local hospitals receiving funding. Rural communities like the ones in Pike County will soon see the effects of the One Big Beautiful Bill Act's cuts to Medicaid, but the Rural Health Transformation Program will hopefully soften the blow. I'm AnnaBrooke Rainey, and this has been the Tropolitan Above the Fold. To read the written version, originally published in the Tropolitan student newspaper, visit tropnews.com. Special thanks to our faculty advisor, Hannah Cooper, and our friends at Troy Public Radio, including this show's producer, Joey Hudson. Thanks for listening and reading.